I'm Dr. Michael Richmond, a double board certified cardiothoracic surgeon. I deal with lung cancer daily. With the increased amount of imaging done in the chest, there is obviously a corresponding increase in the number of pulmonary nodules essentially identified. We're also seeing an increasing number of cases of lung cancer in younger non-smokers. It is imperative that regardless of your age, you need to seek medical attention if a nodule is discovered. For example, let's say you're an athlete and you go and you break your collarbone in college football, and you get a chest x-ray and they see a nodule. You need to follow up. Once a nodule becomes identified, it's incumbent upon a physician to determine whether it's benign or malignant, meaning cancer. Okay, that's the main thing. Now, here's the diagnostic workup. And write this down, please, because it may help you or your family. Well, the workup is guided by size, what it looks like on the imaging procedure, estimating the probability of malignancy by incorporating both clinical and imaging factors. Initial evaluation begins with a dedicated chest CAT scan or CT scan to characterize the nodule, especially if first identified on a chest x-ray, to assess for enlarged lymph nodes, which we refer to as lymphadenopathy, and other factors. Risk assessment needs, obviously, to get the patient's history. What's your age? Did you smoke? Is there prior cancer in your family? What kind of occupational exposures or infectious risk factors? But more importantly, we look at the size of the nodule, the shape, the density, and growth compared to prior imaging if a patient's had a scan previously. Management is stratified by risk. Generally speaking, any nodule greater than 8 millimeters needs to be biopsied. Remember, unless you have tissue, it is not possible to determine whether the nodule is cancer, also known as malignant. The only caveat is that if it is subsolid, in other words, not completely solid, maybe there's some fluid in it, which is referred to as ground glass, longer surveillance is recommended due to its indolent nature, with management based on the size and the development of a solid component. For all nodules or all suspected cancers, a multidisciplinary evaluation is recommended for nodules, especially with high suspicion for malignancy, to determine the safest and most efficient diagnostic approach. In essence, if you ask me, you need to see a pulmonologist or a thoracic surgeon if any lung nodule is discovered to have it worked up primarily. Okay, so the takeaway is, if they see anything on an x-ray or any scan, even if you're not having it for that particular reason, it needs to be worked up, okay? I'm not saying that you need a biopsy at that point. I'm not saying you need anything more, but it needs to be seen by a pulmonologist or a thoracic surgeon. We're seeing cancer in younger, and I mean in 20-year-olds who never smoked, okay? So with that, I hope you learned something today. Thank you so much for listening. For more information, guidance, advocacy, or a consultation by me personally, you can go to my website, www.paladinmds.com, and thank you for listening.